the recording. So this is going to be recorded. If at any point you'd like to discuss something that you don't feel comfortable being on the record or re-recording, please let us know and I can pause the recording and we can continue moving forward. I do want to thank very briefly the Dodge Foundation and Democracy Fund for their support that made this event possible. And I want to thank Oni, who I'm going to turn it over in a second to introduce our speakers, for all the hard work that he's put into this and the work that he continues to put into supporting all of you and the folks throughout New Jersey as he go through and cover these, gesturally broadly everything. So I'll go with that. I'll go ahead and turn it over to Oni, and he can introduce our speakers and give us a little overview of what we're going to be talking about on the call today.
Well, welcome everyone to the Center for Cooperative Media's COVID-19 Fellowship Reporting Training titled How New Jersey Reporters Are Covering the Coronavirus Pandemic. Today's training is the first for this fellowship reporting project, but the third in a series of webinars that the Center has conducted since the coronavirus unfolded in late February. The COVID-19 Fellowship Reporting Project is supported by funding from the Democracy Fund and the Geraldine Dodge Foundation. We have two veteran journalists who are with us today. We sent out the agenda along with their bios, so I will just quickly introduce them. First, we will hear from John Mooney, who co-founded New Jersey or NJSpotlight.com in 2009 as an independent news and information source focusing on public policy and politics in New Jersey. Before NJ Spotlight, John covered education in New Jersey for 15 years as a reporter for the Newark Star Ledger and the Bergen Record, and as a contributing writer for the New York Times. And then he will be followed by Lindy Washburn, who is the healthcare reporter for the USA Today Network's 5 newspapers in New Jersey and a contributor to Gannett's regional health coverage. Lindy has covered healthcare in New Jersey for 30 years and received many awards. Before joining the Record, she reported for the Associated Press in New York, Hartford, and Honolulu. And before that, she spent 5 years doing rural development work in Muslim areas of the southern Philippines. So let's give the floor to John Mooney now. John.
All right, thank you, Oni. It's a pleasure to be here, everyone, and thank you for having us and having this opportunity and this conversation, which I think is a great one. It's great that journalists get to talk to each other once in a while. We're spending so much time talking to others and recording their information, and it's great to get our input and share that as well. I'm looking back to January 29th, and little did I know, NJ Spotlight ran a short story written by a freelancer on Kean University closing or considering to close its campus in China. And because there was this virus called the coronavirus. We didn't know anything much about it. And it looked like a story that was happening in China and wouldn't change our lives the way it has, both as journalists and as individuals living in society as much as it had. We had a couple more stories that week. They were starting to screen at Newark Airport. Again, flights from China. It didn't look like an issue that was going to, take off here. And well, we proved very wrong on that. And in the beginning, we tried not to write, more than 1 or 2 stories a day about it. And we got to a point by March 16th when the first confirmed cases in New Jersey was reported, where I would say, I haven't done a count, but I would say 90% of our stories at least make mention, if not are centered on the pandemic and how it's affecting our lives. There has been no shortage of things to write about. I see in the agenda that I'm, here to talk about where do you get your story ideas, and they are all around us. They are in ways that no story I've ever had in my 30, 40 years of journalism. The only one that came close was the 9/11 and the Trade Center bombing, which certainly it was something we wrote about a lot for the next 6 months, but it wasn't the only thing we wrote about. Now we've gotten to a point where this is practically the only thing we write about. Obviously, the events of the last 2 weeks have also altered that. But in my opinion, I think these things are all interconnected in a lot of ways. I think the strains that COVID pandemic has put on society has led to some of these things boiling over, and there will be more. I think this is not going away. What's very different about this and 9/11 was 9/11 happened and it was recovery. Now we say we're in recovery, but we really don't know, because we don't know anything about second surges and whether there's going to be spikes in cases as people start getting back together again. So I think I can't even say we're in recovery mode. I wanted to talk a little about sort of my experience covering this, and I hope Lindy will certainly weigh in. I'm curious her experience as well, being more focused on the healthcare piece of this. But there are clearly 4 or 5 major issues that are surrounding what is going on now with COVID. One is certainly continuing to be healthcare and the health issues and the medical issues and the numbers. And keeping a track of those numbers in your own communities, I think, is one of the best services you can provide. The state puts out data on countywide levels and statewide levels, and then there's some tools nationally that track it globally and nationally on all kinds of different metrics. One of the things that local media and ethnic media and places like Spotlight, which covers statewide, is I think, have an important responsibility to provide accurate data and information to our communities. And that I found is really probably also been among the most rewarding as a journalist, is feeling that I'm providing accurate and fair and reliable data to the communities around cases, around obviously deaths, but also hospitalizations. I think is one of the biggest indicators of where we're headed with this, is how many people are in the hospital. And I think it's, there is a lot of data out there. And I would, that was one of my takeaways, is the importance of going out and finding that data, whether it's at the state level, and there's a tremendous amount, both mostly out of the Department of Health. And I'm happy to send along links for folks who want to be looking at these dashboards that have, just every day, a whole new set of data around cases, deaths, hospitalizations, long-term care, the number of tests given. And I think those are really valuable, and I think it's important to put it out there. It is state data that it makes it official. It doesn't necessarily make it 100% accurate. I've learned that the hard way. But it certainly does, it has some credibility for sure. And I think it's important to help provide that. In terms of getting that data down into your communities, it's harder. And it's going into municipal websites, municipal departments of health, county departments of health. Again, I can help provide some links on this, but there are stories in that. Are these things spiking? Are they decreasing? Again, I think it's a great opportunity for all media to be providing accurate data on that. Another big area, and it's my core area, is around education and what this has done to schools. I think we all know that this is really remade how schools operate, and now with remote learning. And big issues have arisen of whether families in a lot of communities have the technology to do the remote learning, which is really being relied on. And that's an important story. And one that there's a lot of discussion on social media, in mainstream media, in all media, is how schools are handling this, how schools are providing food to families in need. As we all know, schools are much greater than just classrooms. And so how they're trying to make up for that. And that's, obviously we can't get into school buildings, but we certainly can hold schools accountable for how they're doing that. And making sure that every family, and you can still reach officials at these schools, to be sure. And there's other ways as well, especially through social conversations. I guess I wanted to interject here on one piece is social media, Twitter, Facebook, all those are valuable sources to hear what the conversation is. And I think it's, it provides a window into that conversation that we never had when I was growing up as a reporter. but it's also take it with, as they say, a grain of salt. It is a lot of advocacy. It is, rarely is it purely factual, unless it's actually citing some factual information. I quote it as if somebody was talking on a street corner, but to be able to say that just because you read on Twitter that, that cases are spiking in your community or in a state, verify. I've learned with social more and more that you really can't necessarily count on it as being factual. But it is a good gauge of what's happening in your communities. And whether it's Facebook groups or Reddit or any number of platforms that folks use, I think it is a valuable place to do that. But again, double check. Good journalism is fair and accurate. And I underline the accurate part in this case, because that's what you need to be providing, is accurate information to your communities. And I think that's critically important to what we do as journalists as well. And then the third piece that has been a central theme in this pandemic and in covering it is around the economic impact, the jobs, the businesses. And that's where I think you're going to see more of the stories coming forward, is as businesses open up, how are they doing so? How are they following all these rules that we now are going to be required to have, which change daily? No, I wouldn't say necessarily daily, but it certainly seems weekly. And certainly far from what it was even a month ago. And so those stories are happening on your street corners, and on your streets and in your businesses, and in virtually every family is either dealing with this in their job or in looking for a job. Unfortunately, increasingly, it's more looking for a job lately. But this is really important story that's going to be going forward. I think the health issues are going to be coming back likely, and Lindy can speak to that. But right now, I'd say the next month is going to be focusing a lot on how we return to relative normal, and even how you define normal is going to be interesting. But certainly, looking how communities get back up on their feet and how they follow these rules and whether they follow these rules, I think are going to be important stories for communities to follow, your communities to follow. And a really good source on that is finding what the guidance is coming out of your local towns and the state as a whole. The 6 feet social distancing. How is that exactly going to work in shops that aren't even 6 feet wide, arguably? And again, those are, very local stories. And how do you ensure that everyone's wearing a mask? And if they're not wearing a mask, what are the repercussions from that? I think these are all important stories to be tracking and to be following. Again, listening on social, but also going out and in every which way you can in verifying them. There are a lot of stories that are not being told. I mean, these are some of the broad ones, but we have found that we've gotten a lot of traction in telling stories about what is happening inside prisons. And they've, dealing with releasing prisoners who are at risk. New Jersey has done so, but not nearly as quick as some other states. And to the point where New Jersey had the highest rate of COVID deaths, I think, maybe COVID cases or COVID deaths, the highest rate in the country. And that was a story and continues to be a very powerful story in a lot of communities. We also have done some stories on high COVID rates with farm workers, especially in southern New Jersey, where the agricultural business is dominant. And that is also a really important story that I don't think has been told enough. And we've given that a lot of attention. But as I said, going forward, it's going to be how this economic recovery is going to affect different communities and folks in different socioeconomic conditions. I think some businesses will probably easily recover. Others may never recover. And I think each of those is really an important story to tell. It's been difficult as a longtime reporter who was able to go out and knock on doors and see it for myself. That's something I've missed, tremendously as a journalist over the last 3 months. Something that will come back, but I think it is, really an important piece of what we do is to go out there and get these stories firsthand as best we can. we've also, and I want to, I don't want to take too much time. I wanted to tell a couple of different things that are more about if you're running news services or you're in a position to be dictating coverage. Two things that we've done that I think have been really fruitful at NJ Spotlight, and I think they can be fruitful at any level of a hyper-local or any journalism. One was we had done a lot of events on our live events where we brought people together to talk about issues. And we'd done more than 100 of them in our course of 10 years. We were forced to stop those live events in March, and we have pivoted to doing a lot of online events like this, where we let our readers know that we're going to have conversations like this online, where they have an opportunity to ask questions, and you get folks from within your communities to answer those questions. You get the experts, you get your mayors, you get your councilmen, you get your health directors. To be honest with you, they're easier to get than they've ever been, because now they're sitting at home and not allowed to go out anyway. So we've been able to get them in ways that we hadn't been in the past. And I think that is not only a great way of getting out information, but also a great way of engaging your readers and getting to hear what they care about and the issues they care about. And the other one is we have moved to a daily newsletter that we send out every night. And I'm not saying it's a fair amount of work, so I wouldn't necessarily suggest it every night for folks, but maybe a weekly newsletter that you send to your readers or you provide in different ways that gives them a rundown of, again, what happened this week as it relates to COVID or other matters. What are the great resources that are out there for folks to be able to tap into? I think those are all really, again, it's a real service that we're providing a readership and a community out there that are really desperate for good information. And we are the credible ones. We're the journalists. We're the ones who follow standards of fairness and accuracy. And I think that gives us a unique ability, not just to provide that information, but also to attract and build on a readership that's really desperate for that information. One side bit, and hopefully we'll have more to report on this, but as you know, Montclair State University, with the help of its partners, has been translating some of our stories every week into Spanish, Korean, and Chinese. They are currently available through the Montclair State link, and I know they put it out every morning. And we will soon, and it's been more of a matter of just some technology glitches with our WordPress, we will soon have a section on our site of NJ Spotlight where you can find all these articles in those languages. And so, so if you miss it the first time around, you can go to our site, njspotlight.com, and you'll be able to find these pieces. And we will regularly update that as well. So, big takeaways, the importance of data and really factual information. Again, that also the guidance that the local and state governments put out. Again, that's very factual information on what can and can't be done. And looking for ways to distribute your content rather than just expecting people coming to you, but also pushing it out to them. So I will now pass this on to Lindy, but certainly I look forward to, if there's any questions, to having further discussion on any of this.
Well, hello, everybody. I'm really happy to meet all of you, even if it's only virtual, and hope that we can stay connected. I'm very interested in whatever you produce, the projects that you're going to be doing as part of this media fellowship. And I'm delighted to share the podium, so to speak, with John, with whom we were both young reporters together. The Record, the newspaper that gave birth to NorthJersey.com, is today celebrating its 125th birthday. And they returned to the masthead at the top of the page, "Friend of the people it serves," which was the slogan for many, many years. And so they've resuscitated this now under Gannett ownership. And I just feel it's so apropos in this time where we're all being cast as the enemy of the people, that they're putting it out there, "Friend of the people it serves." Kind of a, warm feeling towards journalists. I hope it engenders. I have been a health reporter specializing in health for about 30 years. And I think there's going to be a new metaphor in the language, which is someone is as busy as a health reporter in the center of a pandemic, because I have never been busier in my writing life. At this time, though, I will say that though I have been a specialist, everybody is a healthcare reporter. And I have been giving sources to the dining out reporter, to the sports reporter who was trying to figure out, whether tournaments should happen or when Little League will resume or when public pools can open, to the State House reporters who are obviously, very much in the weeds with all of the decisions that the governor and the health commissioner are making about whether to reopen the state. So you can have a health reporter who really focuses on the medicine of the pandemic and how the hospitals are doing. But the second part of this is that health care and medical information is a part of virtually every single story today. Even the stories that we're now doing so many of that relate to the protests have that element, because of course we're all concerned whether the people who are demonstrating are now, going to be spreading the coronavirus, or, whether there's going to be any enforcement of masking or any of that. I mean, it's all so very interrelated. I've never felt like healthcare coverage has been so integral to the whole news report as it has been over the last few months. Oni asked me if I would give a quick update on the status on the facts regarding the pandemic in New Jersey. So I can tell you that today the state reported that it exceeded 12,000 deaths from the virus over a period that started on March 4th with the first person being diagnosed at Hackensack Medical Center. And of those deaths, more than half, at least half have been in nursing homes. That's probably underreported. New Jersey is a national disgrace when it comes to the way that the nursing homes have been able to handle the pandemic. And we should have known better, because we had a year and a half ago a terrible nursing home outbreak of a different virus that killed 11 children. More than half of, or age-wise, 47% of the deaths have been in people who are 80 years old or older, which of course relates to the nursing home outbreaks. But we have also been one of the states that has quite a few cases of this new children's multi-organ inflammatory syndrome. Today they added 2 more cases, so we have 37 kids, and the ethnic breakdown of that is a little bit interesting. Because 40% of those kids, which I equate to 15 kids Hispanic, and just 8 of them are white. In terms of ethnicity on the deaths in the outbreak, we haven't had as broad a disparity as has been seen in some other states, but still Blacks and Hispanics are overrepresented in the deaths, and whites are 53%. They would be more in the general population. Now, all of this information comes from the state's New Jersey COVID data dashboard. Somebody will probably put a link up to it there, and it's updated every day. And the information is somewhat behind the times in that it takes a while for some of the data to come in, but it's reliable for the most part. The state has really been way out ahead in a bad way in terms of the number of deaths. Today, we moved from first to second in the nation in the number of people that are hospitalized, and we're third in the nation in the number of deaths per day. We're 19th in new cases per day. So the second topic that I was asked to cover was my information sources. And obviously, John covered that pretty well in terms of official data, the New Jersey COVID data dashboard. In case you wanted to put anything that's happening in different ethnic groups in perspective, the WHO, the World Health Organization, puts out daily updates that show by country how the pandemic is playing out. And those are, that's good to say, like, in the Filipino community, like if you're writing about Filipino healthcare workers and how they're disproportionately being affected here, and you want to show like how the epidemic has played out in the Philippines, which has actually done a pretty good job of containing it. You can get that data from the WHO. In terms of live sources, I talk to hospitals a lot. And I usually make a sweep, once every couple of weeks. I'll have I rotate through and talk to the medical directors or nursing directors at the different hospitals that I cover in the northern part of the state. And those that gives you kind of an overall picture of how the number of hospitalizations is going and where the surge is. Like, we were really able to see ahead of time that New Jersey was very tied into how the New York metropolitan area was doing, especially here in the northern part of the state, and that we were surging way before the rest of the country. Another really great source that I use a lot is unions. You should know, you probably already do, that the healthcare workforce in New Jersey is incredibly diverse, and that's from top to bottom. We probably more than, I believe the last time I looked, more than half of the physicians in the state are foreign born. And in the union that represents the people who work at nursing homes, there's just an incredible diversity. I've talked to Haitians and other islanders, Filipinos, people from many countries who had probably, in many cases, they're overqualified. They might have been doctors or nurses in the country from which they immigrated, and now are entering the healthcare workforce through positions at a lower licensure level, working at nursing homes or congregate care psych hospitals or places like that. Nursing homes, of course, have become like an unexpected focus of a lot of the work that I've been doing. And those union representatives of many different unions have been quite helpful in giving me a complete picture of what was going on there, because their outcry over the lack of personal protective equipment that they had and the sickness and deaths among their workers have really been important stories to tell. Also, just John said, following social media. We put our emails at the end of every story, and I get tons of incoming email asking me to look into things, or just talking about situations that people have encountered. When the whole situation with nursing homes was really being elevated to the attention of the governor and the health commissioner, a lot of families who were so frustrated about their inability to advocate by being inside the nursing homes and visiting would get in touch. I felt like I was a stop on, their strategy list. Look into this nursing home, look into that nursing home, please, get the governor to, to send an inspection team to look into conditions there. I feel that local information, as John said, has been absolutely vital during this pandemic to help people make decisions about how they are going to conduct themselves. Information about testing has proved to be, we now have metrics to measure how many people click on every story. So information that told people where they could get tested and now where they can get tested for antibodies has proven to be really popular. Information on how the individual hospitals were doing enabled people in some cases to decide like whether and when to go to a hospital and which places might have greater capacity for them. And now, as we're trying to figure out individually and as a society how to open up, how to get back into, activities of normal life, I think that people will really need to be aware not only of what the national picture is, but whether coronavirus is coming back and what the numbers are here locally, so that they can have a sense by which to judge their exposure, or what risks they want to take. So that's just purely information. The second key role that we as journalists play, of course, is in accountability. At first, in the early days of the pandemic, we were just running as fast as we could to, to just cover the story. And now I think there's a great deal more reflection about whether the state, the regulators have done a good enough job, whether they addressed problems at nursing homes accurately, as with enough urgency as they should have at the beginning. How the federal government has distributed things from the national stockpile of personal protective equipment, ventilators. There's a lot of questions that are now being asked, and we're getting a chance to take a breath and look at these. And I think that is going to come to dominate the news coverage of the pandemic more and more as we go forward. Finally, there was a third area of coverage that I always try to balance out the stories that I'm doing, both to give myself a little variety and to also, I wouldn't say leaven things or lighten them for the readers, but just to show that this is fundamentally a story about people and people getting sick and suffering. It's been a story of tremendous loss and death, and also of people really making sacrificial decisions to care for others and to put their own lives at risk many times in caring for them. And so I have found that stories that I've done that have focused on individuals in the pandemic, be they nurses or people who have died or patients who have come through after a long time on a ventilator, that these stories are of great interest to readers who can kind of plug into that and relate to that perhaps more than they could to the overarching policy stories. So I think there's room for all three types of coverage: the informative coverage, the accountability coverage, and the personal stories from the epidemic. So I'll leave it at there. I won't leave it at there. If you need general information and kind of good background, questions that you have about how to cover these issues in general, there are two really good sources that I would recommend. One is the Association of Healthcare Journalists, whose website is healthjournalism.org. I've been a member of that since its founding about, 20 or 25 years ago. Every year they have a conference where they give scholarships to have ethnic media come, and people, they give scholarships to reporters who don't specialize in healthcare, but who touch upon it in their beats, to attend their conferences, and which are great learning opportunities. At this time, their biggest contribution they can make really is their website, which has a lot of tip sheets and background material and sourcing information, very practical stuff for reporters. And there's another site that's like that, that's more California oriented, but also has general information, and that's called the Center for Health Journalism. It's at the University of Southern California. And in general, if you're looking for background context on stories that you would be doing, Kaiser Health News is a nonprofit news organization that has done a huge amount of coverage in general on insurance issues and other national health issues, but has a lot of pages of information on the coronavirus. And that's it. Back to you, Oni.
And thank you, Lindy, and thank you, John. All of those fellowships that Lindy presented or mentioned, they are on the chat box. Joe actually provided the links.
Oh, good. Yeah.
Wow. Again, thank you for the very informative and educational reporting tips that you provided for the fellows. We have a lot of questions on queue, and this is also the time for you and John to meet the fellows. Our first question will be from Marie Veer. She works for a Filipino-American news magazine. Marie Veer? I think she is muted, Joe.
How's that?
I can hear.
Yeah.
Okay. Thank you, Oni, Lindy, and John. I have a question regarding the privacy rights of my news sources. Some are willing to have their names real names used, but the others don't. So in a particular story, or on both stories that I'm making, some are okay to be quoted directly and using the real names, the others are not. So in terms of establishing credibility, would I be suffering a lot of questions from credibility of this because I'm not able to put out the real names, or I will just have to stick to my promise that I will respect their privacy?
Shall I go, John?
Yeah, go. You go first.
So I encountered this a lot in my reporting on the conditions in the nursing homes, because many of the workers who were in direct patient care roles were frightened that if they spoke out, they would lose their jobs. And I did not use their names. That was like a condition for many of them, of speaking with me. In some cases, I always asked if they would be willing to have me use their name, and explained that it gave the story added weight and legitimacy, of course, to name people. But when I was interviewing like nurses' aides, I wouldn't, and they didn't want their name used, I would make sure that the story that the facts that they were describing, they weren't the single source for it, that there was more. Usually there were 3 to 5 people who would describe the exact same situation. And that gave me confidence that this was something accurate to report. And I always would say, a nurse's aide who declined to speak because she was afraid of losing her job, or, words to that effect, to explain why the person had requested that their name not be used. I think you really owe it to the reader.
Yeah, I would agree on all those points, especially, trying to, and you should, even with when people are giving you their names, if they're saying something that is, controversial or could be contentious, is doing some additional reporting and making sure that what they're saying is accurate. Are other people telling you that? I mean, I talk to a lot of people off the record all the time, and I think it's worthwhile having those conversations, even if you're not going to use their stuff. I agree, you don't want to hang too much of it, or you want to be careful not to hang too much on confident, anonymous sources. But also, as Lindy says, oftentimes that's the only way you're going to get a story, because people are afraid of losing their jobs. Certainly, we ran into that a lot with writing about COVID in prisons and in some of the migrant farms in the South. So, use your instincts as a journalist, as somebody who knows the folks you're talking to on, and I always like to know, even if their name is not going to be in print, I like to know as a journalist, can I know your name? So at least I can follow up with you. I can promise you it won't run in print, but I'm a little nervous not knowing even your first name. So there's some, interpersonal things that you can do to feel more comfortable about using it. But you're right in asking the question, on what steps you can take to try to firm up what these folks are saying.
Thank you. Marie Veer's fellowship project is on Filipino Americans using traditional healing practices to survive COVID-19 in the absence of the vaccine. The next question is from Raymond Tyler. Raymond? Joe, can you unmute Raymond, please? There you go.
Hello.
Thank you.
All right. Thank you. Can you hear me?
Yeah.
Okay. I think John kind of answered my question, but what has happened with your coverage of COVID-19 in light of the recent week of civil unrest around the deaths of George Floyd, Breonna Taylor, and other people of color? I guess I would follow that up too with, do you plan on covering what was recently uncovered last night about police being overly aggressive with peaceful protesters in New York City. Will that will that cut into your COVID coverage?
Well, I mean, as I mentioned, I think they're all interrelated in a lot of ways. I think they're all, you know, different signs of our society being at a real crossroads. Admittedly, a very tense one, but you know, so I think, you know, covering the protests is not entirely not covering the COVID issue. I think that some of it is feeding into the other. Now, obviously, the protests have had a real you know, a powerful impact in a lot of communities. New Jersey, interestingly, and Newark, really interestingly, has been, you know, almost entirely, at least is reported, almost entirely peaceful protests. And I think that's a powerful story in its own right. But certainly there are certainly issues of looking at how police are handling these protests. New York is getting a lot of attention, but I think there's some valid questions on looking on how police handled some of the COVID issues. There was, especially in Newark, they were putting out, you know, they're giving 200 citations a day for COVID violation of social distancing. And I don't think there has been a really hard look at how those resources were being spent. So, you know, yes, I guess maybe the COVID-centered stories, maybe a few less a day, because we're now doing stories around the protests, and that certainly is, you know, there's only so much manpower to cover these things, but I don't think either of them is going away anytime soon. We have the benefit of, we are now part of NJTV's and Public Media, and they've done a lot of the coverage. The television is, you know, brings some unique resources to actually get on the ground with cameras. And so we've really given them a lot of the coverage of the protests themselves, while we look at sort of some of the more underlying systemic stuff.
Oh, can
Thank
I ask
you.
a follow-up or no?
Raymond?
Yeah, may I ask a follow-up or no?
Can you do that after all others?
Okay, no problem.
Give the questions. Thank you. Raymond is actually working on a story about mental health for African Americans who are disproportionately impacted by COVID-19. Raymond, you can ask a question after this because we have at least 5 questions on queue. The next one is from Karif of Philadelphia Weekly.
Hi, everyone. Thank you for coming on today. I think the question from Marvir pretty much answered mine. That's kind of where I am getting a bit stuck in my reporting, is that while the data is all there to support what is being said by my sources under condition of anonymity, it's been really tough to get people to want to speak on the record for that same exact reason, is they're afraid that if their name gets out, they could lose their job. So I guess you guys definitely answered my question with what Marvir had asked, but I guess if I could add to it, are there any best practices in ensuring a source that what they're saying is supported by data that we're seeing to I guess alleviate their fears a bit? Or is it just a situation where you kind of have to move on to the next person, because no matter what gems you're getting out of this one source, you obviously can't use it for fear of getting that person in trouble?
Wendy?
So I guess I'm not sure exactly of what you mean.
I can give you an example. So,
Sure.
Okay, so one of the stories that I'm working on right now is I'm looking at environmental workers working in hospitals who are one, underpaid, looking for hazard pay, and in some cases have even needed to supply their own PPE. I spoke to one woman even just 2 days ago who basically told me what I've been hearing from a lot of other nursing homes and residential care facilities on how, even though they're a part of the SEIU, who has been fighting for hazard pay since the beginning, it's just been sparse in getting any of it. So like I said, we do have the numbers from the union, which would support a lot of their claims. but obviously hearing it from a worker on the ground adds validity, major validity to the story. So again, I just fear going about using too many anonymous sources and then not being able to, using data, but then saying this person under a condition of anonymity said this, when I really think that like when you don't use the name, it kind of detracts from to your point, the impact of the piece.
I mean, I always feel like it's so much preferable to using the name. And I was a little bit surprised, same kind of reporting as you're doing, when they would, that I could persuade them. Like I would, after we'd gone through this whole long conversation, then I would kind of return to this question of identifying, and I would say like at least half of the time they would say, oh, okay, go ahead, use my name. But when they don't, I mean, I think that's still valid, because if you have the conditions that you're reporting that the union head or spokesman is giving you, then this is, then you're using them as facts. They're the confirmed source. And then this is like anecdotal color
It's
on top of
supplemental.
it. And you
Okay.
need that. You have to have that. And so I can see, I think that's totally okay to do.
Right.
In some instances, the trends that were being reported, they like the union didn't even have a grip on it yet. And so then you're kind of aggregating, like, you're seeing the trend evolve the more people you speak to, and that's slightly different, I think, than looking for the illustrative example.
Okay. Thank you.
And I'd also add, especially on anonymous stuff, but on all stuff really, is getting some kind of response, or getting
Always, yeah,
the other side of the story. I don't think it's quite that simple, but especially when it's being raised by anonymous folks, you got to go back to the hospital or the long-term care. Now they won't probably say much because it's personnel and so on and so forth, but you at least need to give them that opportunity. And they may or may not inform you that this was an extraordinary case or something. I mean, that you start building those relationships. Obviously, relationships are best to be built in good times, not in bad times. But as Lindy's doing and calling around to her hospitals every 2 weeks, it's those relationships that eventually get you some of those stories. So you're going to be doing some phone calls that won't bear much fruit, but they will in the long run if you continue, again, building out those relationships.
Now, I wanted to add something. I don't know if this applies in the circumstance that you're talking about, but I found that there were often like 3 sides to a story. So there was like the unionized worker or the direct care person or the environmental health worker or something with their complaint. And then there's the owner of the facility, be it, residential, care facility or nursing home or something. And then you'd want to get like an outside source. And oftentimes, this was a surprise to me, the local officials, like a mayor or a council member or a local health officer, had information about the situation and could talk about it more. Like they weren't protecting the owner, and they didn't have, they weren't about to lose their job like the employee was, but people had complained to them because they thought they could do something about it. And so that gave like another voice on the problem. And so in a couple of instances, when the nursing homes were just beginning to completely fall apart, like the mayor of Elizabeth, who would have thought, and the mayor of Bayonne, like really gave me some good information. So I don't know.
That's a great idea. And the beauty of those folks, I'll add, is they're somewhat used to talking to the press. And or certainly talking publicly. So you're not, and some of them want the attention. Many of them want the attention. So they can be really good sources, because chances are, if something is as big a problem as we think, they've been told about it.
Right. And even like, I did a lot of work on the Paramus Veterans Home, having like this, now 70 people have died there. And calling an elected official, I mean, who knew that Congressman Bill Pascrell had a brother-in-law who lived there? So he really knew what was going on. I mean, you find these the more calls you make, the more possible connections to, getting the truth you have.
We
That's very
have 3 more questions here, and I know we don't have enough time. So let's give them a chance. Jongwon Lee, he works for the Korea Daily in Atlanta. He's based in Atlanta, but he works at the New Jersey coverage.
Hi, yeah, thank you for your time. And my story is on the conflict of the sanitation mask PP policy between CDC and the Asian immigrant community. The New Jersey has a diverse background of ethnicity, and for instance, Korean and Taiwanese, Chinese follow their own rule regarding COVID-19 sanitation because of language barrier, cultural gap. So, for instance, during first 2 months of the COVID-19 pandemic, CDC discouraged people to wear mask.
Right.
And many Asian Americans try to have one mask, relying on regulation and recommendation from South Korea and the Taiwanese media and the Taiwanese government. But the lots of over 100 complaints of the racial discrimination was filed between 2 or 3 months of pandemic, and lots of this regarding this mask. So now CDC changed the policy and recommended people wear mask, and so people, the Asian immigrants confused which one should I follow.
Mm-hmm.
So that's the one problem, and so I believe this policy change may affect the distrust on the CDC and the US government. For instance, I've met lots of Oriental acupuncturists and chiropractors who claim so all of these COVID-19 hoax and conspiracy. There is no COVID-19 because they believe, yes, because they rely on their Oriental medicine knowledge. So, and many Asian immigrants still following their direction because of the language barrier, lack of information, and so the CDC policy change. So how can we fill gap between Asian and non-Asian community regarding COVID-19 policy and regulation? Yeah.
That's a tough one. There is no question that
Yes.
knowledge of this epidemic and the ways of preventing the spread of the virus has changed dramatically from the early days. First, they didn't realize there was pre-symptomatic spread. Then they didn't think it was airborne. They thought it was all, water droplets and things like that. And the story of the CDC, of course, is something that you could spend many hours and seminars talking about what went wrong there. I think that culturally, the Asian countries were really very much more prepared for wearing masks because of the experience with SARS and previous pandemics. And obviously, if you can't rely on the CDC and the US government, I don't know what you can rely on, and that's been the best we've put out there, and that's like a big problem that they got it wrong. So.
Let's move to the next question because we have very, very limited time left. Don Tagala works for ABS-CBN News in New Jersey and New York. Don, can you ask your question, please?
Can you hear me now?
Yes.
Okay, cool. So I'm really curious about, are there any particular type of stories that receive more attention or interest from your readers or from your viewers? Is it the scientific side, health side of COVID-19, or is it the political side, like how the Trump administration handled the whole crisis, or the economic side, how everybody lost their jobs, or is it mostly the human interest, emotional type of stories, people losing their loved ones? So which type of stories are receive more attention?
I'll quickly answer. All of the above, certainly, but what has not surprised me, but heartened me is the information. When we put out factual information and do stories that explain how to get insurance, disability, or explain how to get your unemployment filing, those kinds of things, they get a lot of attention. Things that provide a value to the readers in terms of knowledge on where to go, where are the resources, the data, some of the simpler stuff. It's not the big blockbusters that necessarily, they're great too, and they get a lot of attention as well. But those little explainers get a ton of attention and are really, I think, doing a real service as well.
Okay, thank you. Let's give the last question to Rong Shaoqing. She works for a Chinese language daily, Xingtao Daily in New York and New Jersey. Rong. I think she is muted. Joe?
She should be good. She's unmuted.
Rong? I think she's not there anymore.
Yep, she is. She just remuted herself, so.
Oh, Rong, are you there? Nope.
Oh, well.
Then let's give this chance to ask his question from Dominic Kevin McNear of the New Jersey Urban News. Kevin?
All right. Hi. Hello.
Hey.
All right. I'm trying to get my photo up. I can't see myself. Don't worry about it. I got too many screens open. So look, I am looking at disparities between African Americans in several different contexts. That is, I'm the editor in New Jersey for the Urban News, New Jersey Urban News. I'm also the editor for the Washington Informer that covers news out of Washington, D.C., Maryland, and Virginia. And what I'm finding is the willingness to respond is markedly different in certain states. And I was wondering how you delicately manipulate that. For example, Maryland is very forthcoming in giving information. I found it to be a much tougher road to hoe with New Jersey. And I thought that because if I was working with national organizations, they would be able to link me in right away. But they're saying, go to our local organization. And when I do that, when I go from DC to Jersey, I'm finding a lot of reluctance. And I'm just wondering if you've had similar experiences. I've heard some of your conversations, what you might suggest.
Well, I'll quickly say yes. New Jersey is not doing a very good job on the transparency, but I'm sure Lindy has run up against it more than I have, so I'll let you close.
So are you talking about getting like government information or from like branches of different organizations?
Both. But I will tell you, I'm also an ordained elder. I used to pastor a church in Jersey. I was going to actually call the church and have them give me some people in nursing homes and then do it back door. But I don't want to do that. I really want I want the facts. I want hard facts. And so I was trying to do the way I've been taught to do it. But I'm finding a lot of closed doors or doors they open partially. And once I start asking some tough questions, they say, well, you can look at this, you look at that. And the data's old or the data's irrelevant. And so then I got to go back and refigure a way I have to reroute, as it were.
So, I mean, it's just been a huge, huge problem, the lack of transparency. And I mean, when you were talking about nursing homes, like it took 3 weeks of agitation to get individual numbers reported on where outbreaks were in nursing homes. At first, I don't know what they thought it was going to be damaging to their businesses. I mean, if people die, it would be damaging to their business too. But so we have done a lot of OPRAs, Open Public Record Act requests, and we keep a tally of those, and most of them have been delayed because the deadline was suspended during the state of emergency. So I can just say, like, I feel your pain. It is a big, big problem, you know.
You know, we have a lot of questions left. Unless you have another minute or so, we can give another more question. or we can just send you all those questions and then you can just provide the answers via email.
I mean, I'm happy to help people out and would love for you, email me at will. My email is washburn@northjersey.com. But I have a more time too, if depends, John.
Yeah, I can talk. I can go for a little while longer. And also certainly open to talking to folks through email. It's jmooney@njspotlight.com.
Yeah, we'll provide all that contact
But
information.
I have a few. I have a couple minutes if there's.
I have until 4:10. So we got 5 more minutes if we want to
Okay.
take one more question. If anybody ever wants to stick around, that's cool. It's fine.
Let's then
Do you
give
want
it.
to go back to Wrong though? She is here. She says.
Okay,
Can you ask me
Wong.
help the questions?
Can Wrong and then Moshin just ask their questions? At least they have their questions, presented.
She says, John, how much weight does NJ Spotlight give to the clicks of a story when assigning or choosing a story to cover? She asked for help asking the question.
Yeah, I mean, I think it's a valid question. It's a balance. We don't, just put up stuff to get clicks. Our kind of coverage isn't that kind of thing anyway. I mean, we're certainly more looking at policy and regulations and the like. So we would not fall into the category of clickbait. Just the opposite. We're probably anti-clickbait. But in some ways, you also want to know the stories that are getting a lot of attention. So I certainly look at what are our big stories of the day, and sometimes it's the stories that we put the most into. But as I mentioned, sometimes it's a data map or an explainer on, PPEs versus, other, different kinds of PPEs. We did an explainer on the different kinds of testing that just sort of laid out and, the different, the antibodies and the rest and how they work. And that was a huge hit. So I don't ignore them. And I look at our traffic every day, all day. So I know what's being well read, but certainly I'm not necessarily also putting up things that I know will get a ton of traffic. It's a balancing act, but you do want to know your readers. I think it's important to know who's reading you and who's reading what. So that's a bit of a change from the days when I was at a newspaper and we didn't even, always think about how much our stories were necessarily getting read. We just kept printing them. Certainly being an online news service, you have to be a lot more cognizant of your audience.
And then 2, for Lindy, New Jersey is so big, how much time do you spend commuting if you have to cover the whole state?
I'm commuting downstairs to my dining room these days.
Yeah, I was going to say.
Yeah. No. So we have, Gannett has like 5 newspapers all over the place, and I coordinate with them. I don't commute that far. I mean, I do a lot of my work on the telephone and online, and go places when I really want to get the color for stories.
One resource that you all should be aware of, I mean, I'm guessing you probably are, but it's there for everybody, is the daily press briefing that is going on in Trenton every day, at least every weekday. It's not daily anymore, but it's every weekday, typically at 1 o'clock, but you find it on the governor, and he'll spend an hour taking questions. Now, it helps to be there in the room, but if there are questions, I am open to seeing if we can relay some questions towards him. If you think that are of statewide interest or that he would know about, if you get too local, he's not going to know about it, and it will be a wasted question. But this happens every day, and he's talking about the hot issues of the day. He's announcing unemployment. Now, sometimes he's avoiding the hot issues of the day, and that's when the reporters bring them up. But it's a good resource, and it's an hour of your day, but it gives you a heads up of what's going to be in the headlines, in the next hour or 2 or day. So, and it's right there. And with the power of the internet, one can watch it. And you have my email. Feel free, if you think there's a question that he should have to answer, send it to me as an email, and I'll see if I can get it in the pipeline.
Wonderful. I think we can't thank enough for your time and for sharing your knowledge, but we have to end it here. It's 4:10. We will send your contact information to the fellows, and we will also send you their contact information. If they have follow-up questions, I'm sure they will send you or contact you individually.
Yeah, and if anyone would like to, if anyone saw anything good that you're working on, you'd like to collaborate with anyone else in the call, like we do every one of these calls, you just reach out to me or Oni, let us know who you'd like to be put in touch with, and we'll make sure you get connected. Also, urge you all to sign up for the news, the email listserv for the News Commons partners. That's bit.ly/joinnjnc. It's an email listserv where we just send out all kinds of information and useful resources. So thank you again for everyone. Thank you to our wonderful speakers. Thank you to our supporters, Democracy Fund and Dodge Foundation, and we'll talk to you all soon.
Thank
Great.
you.
Thank you very much.
much.
Yeah,
Bye-bye.
Bye-bye.
Bye.
Take care.